Good morning, everybody. Yesterday was a record of 110,000 people in New South Wales who got the jab, who were vaccinated, and that is a phenomenal outcome, and I encourage everybody to please come forward and get vaccinated. To date, we have 5.5 million jabs that we've given in New South Wales. 53% of our population has had at least one dose, and 28% of us are fully vaccinated. And obviously, we want to see these numbers climb as quickly as possible. So thank you to everybody coming forward to getting vaccinated. In the last 24 hours, we had 119,000 people come forward to get testing. We had 681 cases of community transmission, with 59 at least infectious in the community during that time. And we extend our sympathies and condolences to the family of a man in his 80s who died at St George Hospital in the last 24 hours. He'd had one dose of the vaccine and did have underlying health conditions. And we extend our deepest sympathies to that deceased man and to the family of that deceased man. In relation to the areas that remain a concern, Western Sydney and South Western Sydney are generating the vast majority of our cases, and I'll go through the suburbs of concern, but we also have with us today Commissioner Shane Fitzsimmons from Resilience New South Wales, who has been working closely with government and non-government organisations in those communities to make sure that people are well supported and make sure they have every opportunity to stay within the rules in relation to the virus. In relation to the suburbs of most concern, Merrylands, Guildford, Auburn, Granville, Lidcombe, Greenacre and Blacktown are the suburbs that Health wants us to call out today. They are the areas where there's the fastest growth in cases. It doesn't mean there aren't other areas that we're concerned about, but they are the main ones. And we ask everybody in those communities to assume, first of all, you should be staying at home, but assume the second you put foot outside your door that you have the virus or anybody you're coming into contact with has the virus. In Western New South Wales, we remain concerned with the cases bubbling along, especially around Wilcannia and Dubbo, and the Deputy Premier will give an update on what is happening in the regions. Things are settling down in other parts of regional New South Wales, which is positive, but obviously our concerns remain about Western New South Wales in particular. I also want to announce, and the Deputy Premier will reinforce this as well, that given the outbreak in Western New South Wales and a few cases elsewhere throughout the regions, that the lockdown in regional New South Wales will align with the rest of New South Wales. So until at least the 28th of August, all of regional New South Wales will also remain in lockdown as a precaution. We know that there are vast areas of regional New South Wales where there aren't any cases, but everybody would appreciate and expect us to take a precautionary response, given we have the opportunity to get down to 0 cases in the regions. That's certainly what we want to achieve, and therefore we're taking that precautionary response. As I mentioned at the outset, New South Wales is already up to 5.5 million jabs, and once we get to 6 million jabs, those that are vaccinated will have the opportunity to be able to do something they can't do now. And I really want to stress how pleased I am with the number of people that have responded to vaccines and coming forward. And I want to remind the people of this state that once we get to the end of October, we expect 70% of our population to be fully vaccinated. And once we get to mid-November, we expect 80% of our population to be fully vaccinated. And that gives us enormous opportunities to have greater freedoms than we do today. I also wanted to encourage again anybody between the ages of 16 and 39 who lives in those local government areas of concern throughout Western Sydney and southwestern Sydney, please come forward and get vaccinated. The federal government gave us 500,000 extra doses of Pfizer, and we have 2.5 weeks to get it out to everybody. So please come forward, go online and book. You'll be given priority. We know that age group in particular are the ones that are having to work, the ones that kind of are the conduit between generations, and we know that around 3/4 of all cases in those areas of concern are people under the age of 40, and for that reason we're really focusing on those rates. I know these are challenging times, but I also can see the light at the end of the tunnel. These are difficult times for all of us, and the next few weeks will be hard. But know that once we hit those higher vaccination rates, life will feel much better. Life will look much rosier. And I appreciate what we're going through is difficult. But every state in Australia will have to come to terms with the fact that when you get to a certain level of vaccination and start opening up, Delta will creep in. We can't pretend that we're going to be 0 cases around Australia of Delta. As the Doherty report says, once you get to 80% double doses and you have to open up, everybody's going to have to learn to live with Delta. Admittedly, in New South Wales, we're learning that earlier than others. But having said that, what I'm absolutely convinced about is New South Wales can lead the way in making sure we keep people out of hospital, reducing the deaths, and making sure that we provide our citizens the opportunity to live as freely and as safely as possible. And whilst every single death is a horrendous tragedy, what we need to ensure is that through higher rates of vaccination, if we keep people out of hospital, we keep people out of intensive care, we stop people dying, that means we're starting to live with COVID. But I want to manage those comments with the fact that everything we need to throw at reducing the case numbers. So whilst the high vaccination rates gives us those opportunities to live more freely, it is not in any way a comment that we shouldn't get the case numbers down. We absolutely need to. We need to turn the corner. And that's why we look at every opportunity we have, especially in those areas of concern of what more we can do. And Commissioner Fitzsimmons will speak about that as well.